If you're over 50 and taking turmeric for inflammation, joint pain, or overall health, what I'm about to share could prevent dangerous interactions that might be harming you right now. Turmeric has become incredibly popular as a natural remedy, but combining it with 4 specific foods can create serious health problems, especially for seniors whose bodies process nutrients differently than younger adults. Turmeric contains curcumin, a powerful anti-inflammatory compound that's been praised for reducing arthritis pain, lowering inflammation, and supporting brain health. Many seniors take turmeric supplements or add turmeric powder to their foods daily, thinking they're doing something beneficial for their health. The problem is that turmeric doesn't work in isolation. When combined with certain foods or consumed by people taking specific medications, it can trigger dangerous reactions ranging from excessive bleeding to digestive distress to medication interference that could be life-threatening. After age 50, your metabolism changes. Your medication list often grows longer, and your body becomes more sensitive to food interactions. What might be a minor issue for a 30-year-old can become a serious health threat for someone over 50. Understanding which foods to never combine with turmeric is absolutely critical for protecting your health while still getting the anti-inflammatory benefits this powerful spice can provide. Today we're going to explore the 4 foods you must never eat with turmeric after age 50, why these combinations are so dangerous, and what to do instead to safely incorporate turmeric into your health routine. The first food you should never combine with turmeric is ginger, which might shock you because these 2 spices are often recommended together in health articles and recipes. While both are beneficial individually, combining them creates a dangerously powerful blood-thinning effect. Both turmeric and ginger have natural anticoagulant properties, meaning they prevent blood from clotting normally. When you combine them, especially in concentrated amounts like supplements or large quantities in food, you dramatically amplify this blood-thinning effect. For seniors over 50, this is particularly dangerous because many are already taking blood-thinning medications like warfarin, Coumadin, aspirin, or newer anticoagulants. Adding the combined blood-thinning effects of turmeric and ginger on top of these medications can lead to excessive bleeding. This bleeding can manifest as easy bruising, bleeding gums, nosebleeds, blood in urine or stool, or in the most serious cases, internal bleeding that can be life-threatening. Research published in the Journal of Thrombosis and Hemostasis has shown that curcumin from turmeric significantly affects platelet function and blood clotting pathways. When combined with ginger's similar effects, the impact multiplies. Even if you're not taking blood-thinning medications, the combination can be problematic. As we age, our blood vessel walls become more fragile, and excessive blood thinning increases the risk of hemorrhagic stroke, where a blood vessel in the brain ruptures. The danger is amplified because both turmeric and ginger are common ingredients in many health tonics, golden milk recipes, and anti-inflammatory teas that seniors consume regularly without realizing the cumulative blood-thinning effect. If you're taking turmeric for inflammation, do not combine it with ginger in the same meal or supplement. Space them out by at least 12 hours if you want to consume both. If you're on any blood-thinning medications, avoid this combination entirely and consult your healthcare provider before using either turmeric or ginger therapeutically. Watch for warning signs of excessive bleeding, unexplained bruises, prolonged bleeding from small cuts, blood in urine or stool, or unusually heavy menstrual bleeding for women still menstruating. The second dangerous food combination is turmeric with black pepper, which creates a completely different problem. Black pepper is often recommended with turmeric because it contains piperine, a compound that increases curcumin absorption by up to 2,000%. While enhanced absorption sounds beneficial, it actually creates serious risks for people over 50. When curcumin absorption increases this dramatically, it can interfere with how your body processes medications, leading to dangerous drug interactions. Turmeric is processed by the same liver enzymes that metabolize many common medications, including statins, blood pressure drugs, diabetes medications, and antidepressants. When piperine dramatically increases curcumin levels, it can overwhelm these liver pathways. This interference means medications may build up to toxic levels in your bloodstream because your liver is too busy processing the excessive curcumin to properly metabolize your prescriptions. For people taking statins, the combination of turmeric with black pepper can increase the risk of muscle damage and liver toxicity. Statins are already processed by liver enzymes, and flooding those pathways with high-absorption curcumin creates dangerous competition. The enhanced absorption also increases the risk of digestive problems. High levels of curcumin can cause stomach upset, nausea, diarrhea, and acid reflux, particularly in seniors whose digestive systems are more sensitive. Research shows that curcumin can also lower blood sugar significantly. When absorption is increased 20-fold by black pepper, this blood sugar lowering effect becomes dangerously amplified for people taking diabetes medications. The combination could cause hypoglycemia, where blood sugar drops too low, leading to dizziness, confusion, shakiness, rapid heartbeat, and in severe cases, loss of consciousness or seizures. Many turmeric supplements specifically add black pepper extract or piperine to enhance absorption, making this a hidden danger in products marketed as beneficial for seniors. If you're taking any medications regularly, avoid turmeric supplements that contain black pepper or piperine. Choose plain turmeric or curcumin supplements without absorption enhancers. Never add black pepper to turmeric drinks or golden milk if you take prescription medications. The risk of drug interaction far outweighs any potential benefit from enhanced absorption. If you want better absorption, consume turmeric with a small amount of healthy fat like coconut oil or olive oil instead. Fat enhances absorption moderately without the dangerous drug interaction risks of black pepper. The third food you must never combine with turmeric is iron-rich foods or iron supplements, as turmeric significantly inhibits iron absorption and can contribute to or worsen anemia. Turmeric contains compounds that bind to iron in your digestive tract, preventing your body from absorbing this essential mineral. For people over 50, particularly women who've experienced years of menstruation or anyone with a history of anemia, this can be seriously problematic. Iron deficiency is already common in older adults due to poor diet, reduced stomach acid production, chronic diseases, or medications that interfere with absorption. Adding turmeric into the mix can push borderline iron levels into deficiency. Anemia causes profound fatigue, weakness, shortness of breath, dizziness, pale skin, and cognitive problems like poor concentration and memory issues. For seniors, these symptoms are often dismissed as normal aging when they're actually caused by preventable iron deficiency. Studies have shown that curcumin can reduce iron absorption by up to 90% when consumed together. This means that even if you're eating iron-rich foods or taking iron supplements, you may not be getting the iron your body needs. Red meat, liver, spinach, lentils, and fortified cereals are all high in iron, and consuming turmeric with these foods significantly reduces their nutritional value. Iron supplements are commonly prescribed for seniors with anemia, but taking them with turmeric completely negates their effectiveness, leaving the underlying deficiency untreated. The interaction works both ways. Not only does turmeric prevent iron absorption, but iron can also reduce curcumin absorption, so neither nutrient is being properly utilized. For people taking iron supplements, this means months of supplementation could be wasted, because turmeric consumed at the same meals prevents absorption. If you need to take both turmeric and iron, separate them by at least 4 to 6 hours. Take iron in the morning with vitamin C to enhance absorption, and reserve turmeric for evening meals. Avoid taking turmeric supplements with iron-rich meals. If you're having beef, liver, or iron-fortified foods, skip the turmeric at that meal. If you have iron deficiency anemia or low iron levels, prioritize correcting your iron status before incorporating turmeric supplements into your routine. Have your iron levels checked regularly through blood tests if you're using turmeric therapeutically. Monitor for symptoms of anemia like unusual fatigue, weakness, or pale skin. The fourth dangerous food combination is turmeric with high oxalate foods like spinach, beets, nuts, and chocolate, which dramatically increases kidney stone risk. Turmeric itself is moderately high in oxalates, containing about 91 milligrams per ounce. Oxalates are compounds that bind with calcium in your kidneys to form calcium oxalate stones, the most common type of kidney stone. After age 50, kidney stone risk increases naturally as kidney function declines, and the body becomes less efficient at processing and eliminating oxalates. Combining multiple high oxalate foods in one meal creates an oxalate overload. When you eat turmeric with high oxalate foods like spinach, beets, nuts, sweet potatoes, or chocolate, you're consuming massive amounts of oxalates that your aging kidneys struggle to eliminate. This creates the perfect conditions for crystal formation in your kidneys. These crystals can grow into painful stones that cause severe back pain, blood in urine, nausea, and may require medical procedures to remove. For people who've had kidney stones previously, the risk of recurrence is extremely high, about 50% within 5 years. Consuming multiple high oxalate foods together virtually guarantees recurrence. The popular health trend of adding turmeric to green smoothies with spinach, nuts, and other high oxalate ingredients creates an oxalate bomb that's particularly dangerous for kidney health. Golden milk made with turmeric and almond milk combines 2 high oxalate ingredients, and when people add this to a meal with other oxalate-rich foods, they're setting themselves up for problems. The cumulative effect of oxalates is what matters. Eating turmeric occasionally with spinach might not cause issues, but doing it regularly or consuming multiple high oxalate items together creates serious risk. Seniors with declining kidney function are at especially high risk because their kidneys can't efficiently filter and eliminate excess oxalates, allowing them to accumulate and form stones. If you want to use turmeric, avoid combining it with other high oxalate foods in the same meal. Have turmeric with low oxalate vegetables like cauliflower, cabbage, or bell peppers instead. Never make smoothies that combine turmeric with spinach, almonds, beets, or other high oxalate ingredients. Choose 1 high oxalate food per meal maximum. Drink plenty of water throughout the day to help your kidneys flush out oxalates before they can form stones. Aim for 8 to 10 glasses daily. If you've had kidney stones, work with your healthcare provider before using turmeric therapeutically. They may recommend limiting turmeric or monitoring your oxalate intake carefully. Beyond these 4 dangerous food combinations, there are additional important considerations for safely using turmeric after age 50. Always inform your healthcare provider about any supplements you're taking, including turmeric. Many doctors don't ask about supplements, so you need to volunteer this information. If you're scheduled for any surgery, stop taking turmeric at least 2 weeks beforehand. The blood-thinning effects can cause excessive bleeding during and after surgical procedures. Start with very small amounts of turmeric, especially if you're new to it. A 1/4 teaspoon daily is sufficient for most people, and you can gradually increase if needed. Choose high-quality turmeric powder or supplements from reputable brands that test for purity and heavy metal contamination. Some turmeric products have been found contaminated with lead. Consider whether you actually need turmeric supplements. If you're not experiencing significant inflammation or joint pain, you may not need therapeutic doses. For cooking purposes, small amounts of turmeric in curries or rice are generally safe and unlikely to cause the problems associated with therapeutic doses in supplements. Watch for side effects, including digestive upset, acid reflux, diarrhea, or unusual bleeding. If you experience any of these, stop taking turmeric and consult your healthcare provider. Never exceed recommended doses, thinking more is better. High doses of turmeric can cause serious side effects, including liver damage, kidney problems, and dangerous drops in blood sugar. Be especially cautious if you have gallbladder disease. Turmeric can stimulate bile production and worsen gallbladder problems or trigger gallbladder attacks. The bottom line is that turmeric can be beneficial for reducing inflammation and supporting health, but it must be used carefully and thoughtfully, especially after age 50. By avoiding these 4 dangerous food combinations and following safe usage guidelines, you can get turmeric's benefits without the serious health risks these interactions create. Your health and safety are too important to risk with preventable food interactions. Make informed choices about when and how you use turmeric to protect yourself while still supporting your well-being.